Thank you for your introduction. Okay, so our main aims and objectives were to evaluate if radiographers wash their hands properly. This is on a team of CT radiographers. Assess if those radiographers used gloves correctly. Check also if the materials and the equipment that they touched and they used were disinfected when necessary. And also to assess radiographers' perception about hygiene standards. Our methods and materials, we used a descriptive correlational study with a self-applied questionnaire which radiographers answered and gave their knowledge on hygiene measures. We had applied this to 35 radiographers within 2 radiology departments. And we also used an observational grid where we checked if the protocols were correctly followed. The observational grid contains a list of necessary steps for the application of infection prevention measures by radiographers in order to check the following procedures if they are performed or not. The observational grid had basically these items: hand washing before the procedure, hand washing before putting on gloves, then removing the gloves properly, hand washing after removing the gloves, the individual use of gloves, disinfection and protection of the equipments and materials used, the use of aprons and masks when necessary, and the availability of personal protective equipment. The questionnaire was translated and validated to the Portuguese language and had 19 items, which we applied to the radiographers. %80 of radiographers had training in the hospital about infection control measures. 65.7% of them indicated the option less common about hand washing before putting on the gloves, so not a very common procedure. Almost 15% assumed that they never did it, and 60% of radiographers wear gloves immediately before the procedure. 22% indicated that they didn't know about the existence of hospital protocols for the use of gloves in the department, and 28% said that there aren't such protocols. 40% consider as high, and 51% has medium concerning the risk of diseases, transmission, and or occupational accidents. So not a lot of risk perception. So 60% of radiographers used gloves prior to the procedure, but only half of them washed the hands after removing the gloves. We also found that sometimes radiographers that put on the gloves prior to the procedure then use the equipment, for example, the keyboard and the workstation, with their gloves on. So basically not a very effective way of using the gloves. During the observation, the use of gloves occurred in 10 out of 18 radiographers on the CT team, and 14 of them never did it after removing the gloves. The correct use of gloves was not fully verified in any of the participants, and about 3% of them reported use of the same gloves for different procedures. So another major problem, an incorrect use of gloves and personal protection. So the results obtained allow us to conclude that there is some unconcerned and lack of awareness by radiographers in relation to the potential risks caused by not changing gloves between procedures, and even within the procedure itself. Radiographers were aware of infection control guidelines, but several of them failed to apply these procedures. Also, as I said, we had an observational grid, so the student that did this data gathering was with the radiographers. So the subject, of course, has some influence. Basically, the results would be worse if there isn't an observational grid and a radiographer in the room. So thank you very much.